Hi, everyone. Thank you so much for coming back to What's Up, a podcast for undocumented and AAPI resources. We're joined today by Ria, Casey, and Blue once again, and my name is Spoon. Today, we're going to be talking about health resources for immigrant communities. But before we do that, we want to do a quick policy updates as we do every single week on every single episode. So, today's date is April 7th, Wednesday, as always, 2021. We're going to go over policy updates. So for those who are listening to previous episodes, there really isn't too much updates as of this moment even pertaining to immigrant policies, but there are some things that we as organizations, as KRC, Korean Resource Center, being a part of a big organization, have been working on a national, state, and local level. So KRC is part of a organization with NACASEC, and we've been doing the first 100 days campaign where we've been phone dogging, basically calling our representatives every single day for the last, I think, since starting in the first day of the Biden administration. We've been calling our representative to make sure that they listen and they understand that immigration reform is necessary part and needs to be on the front lines of our community's conversation. So we've been calling them every single day. We've been holding rallies in on the East Coast, Washington D.C., as well as New York City, as well as in overall New York, all the way in the East Coast. We've been advocating a lot of on there. Be sure to check out our social media. Our main social media, which is the Korean Research Center social media, KRCLA, hashtag ampersand KRCLA. Be sure to check us out on there. Yeah, be sure to do that. In terms of local campaign work, we've been part of the Yes Immigrant Forward campaign, which is a campaign done locally as well as this California state level. We've been advocating for immigrant voices by promoting and producing videos where we highlight a lot of the issues that are happening in immigrant communities and really providing a platform and a space for immigrant youth as well as immigrant communities to talk about why immigration reform that is inclusive and humane is necessary for our community as of this moment. So without further ado, we're actually going to go a little bit about the health resources for immigrant communities. We're going to talk a little bit about it. So a lot of the resources we have right now today is provided by the Undocumented Alloy. Undocumented Alloy is a community-led organization and a bunch of workshops that have been done through them. They are a community from undocumented folks, undocumented API folks that are coming together to create resources for all of us here. So it's created by Undocumented Alloy, which stands for API Leadership, Opportunity, and Empowerment. So Undocumented Alloy was developed by 6 API individuals who are passionate in providing an inclusive community for undocumented API folks. Through this gathering, Alloy hopes to share resources and build a support network for undocumented APIs. Alloy is a perfect space for undocumented APIs who are exploring their identities and seeking resources and wanting to connect with the community. So with them, they did a presentation on some of the resources that are provided that are available for undocumented API folks. So here's some few things. In terms of healthcare, there are free and low-cost healthcare by Free Clinic Directory, which is a website where you can go. We're going to provide those links in our description, where you can search for free clinics. It's a safe website that allows you to find resources near where you live, so that you can find resources that you need for you closest to you. There's Undocumented Life put together a list of a clinic and hospitals for uninsured and undocumented folks. The link is right provided. We're going to be providing as well, but you can find it on myundocumentedlife.org health where you can find a lot of undocumented immigrant resources. Just to be fair, we're not sure if these are updated throughout, but it is some resource that you can start. If you're residing in California, as many of you might be, California Department of Healthcare Services resources for folks who have DACA. Department of Healthcare Services for those who have DACA is on the website dhcs.california.gov, and you can find some resources for DACA recent information. So it's asking questions like whether or not are DACA eligible for Medi-Cal, and yes, it is under existing Medi-Cal policies. Individuals with DACA status will continue to be eligible for state-funded resources. This is in particular to very specifically DACA folks. So another resource is Los Angeles County offers free and low healthcare services to My Health LA to low-income families, regardless of immigration status. Also, because of the time we're living right now, because of the COVID pandemic, there are some resources for healthcare during COVID pandemic for undocumented immigrants. There should be no cost associated with COVID-19 testing, vaccines, and treatment to anyone, regardless of immigration status, especially in California. United We Dream has created healthcare access for undocumented folks in time of COVID. Again, I'm not sure if this was maintained consistently. Last time we see that it was updated, it was March 19, 2020. But there are some resources here that we can provide in the link below. So yeah, without further ado, we're actually going to talk a little bit more about conversations on what are some willingness to seek resources. I know that the undocumented community are scared about resources, having to find resources, and especially during a pandemic, healthcare and health resources has been in our minds. I think it's I want to ask the members here, those who might, whether or not they might be undocumented APIs or just amazing community members, what are some conversations or what are some thoughts on their willingness or just their community's willingness to seek out resources? Anybody?
Yeah, I can begin talking the conversation. It's Blue here, by the way. Pronouns he, him, and then yeah, for me personally, I have never been very open to reaching out resources in terms of my health and like my family's health, just because of my status. I understand that there are clinics that offer free, low cost services for undocumented people regardless of our legal status, but it's more so about not being in the system, because I have read stories about people that reach out for help in those clinics, and then eventually that information gets uh, gets in their own hands of people that don't have the best interest in their mind, and then some things can happen. And so when I read those type of stories, it kind of makes me very hesitant, because I know that the hospital's best interest is the health of the patients, right? But in today's sort of healthcare like ecosystem of today, it feels like it's a business now. The sickest patient is the one that's going to give you the most money because they need the most treatment. But so that's what makes me very hesitant. It's like the costs of it, even though I understand that there are free costs for undocumented people, but then there were moments where my parents needed like specialized treatment, and oftentimes those kind of specialized treatments are not like covered by those free services provided. So we have to kind of use our home remedies or over-the-counter medications things to try to mitigate those sickness or injuries. But yeah, at the end of the day, there are many reasons why I tend to avoid help, and I hope that can change over time. But yeah.
Yeah, thank you so much, Blue, for mentioning that. I think definitely conversations about, I think whether or not there is resources, I think we're still, a lot of the undocumented API folks, especially undocumented folks in general, feel scared to even look for one, or where to even look for one, or how to even ask, right? I think this is something that we addressed last week when we talked about mental health. How to even ask, where to even ask, how to even ask for resources? You don't even know where to go. You don't even know who to ask. Anybody else before we move on to the next conversation about hospitals?
I can go next. Hi, everyone. It's Ria again. My pronouns are she, her. And I can relate to the fear of having information be in the wrong hands. It's really difficult to find health resources, and it's really difficult to do anything without health insurance, or it feels like I am more prone to injury and being sick. And so for a while, I was really privileged to have health insurance from my school. And then once I graduated from college, that was when I realized, oh, healthcare really isn't as available as I thought. I mean, we all knew that there's no such thing as um, universal healthcare in this country where everyone can get their basic needs met, but I found it really, really difficult to. I thought you could just, go into a hospital and then get treated there, but then hospitals will ask for a lot of things, or hospitals will not even treat you because you don't have health insurance. Or, but if you have the money, then sure. But everyone knows how expensive going to the doctor is. Um, but I think what helps though is, or I was able to build my trust with some places. For example, My Health LA, like what Spoon mentioned earlier. I trusted that system because another undocumented friend of mine went through that system as well. And for years and years, she was advocating for it. And thanks to her taking the risk, and thanks to her family taking the risk and getting their needs met, I felt comfortable to follow in their steps. And I wouldn't do that unless I know somebody else who went to that same program. So I I still don't trust the system, but I think I should also take advantage of what the system can give us for now. That's a little bit of what I think.
All right. Thank you so much, Ria. Yeah, I think definitely a lot of the people have, undocumented communities as well as immigrant communities in general who never really had an opportunity to ask for resources. I think it's really hard to do so. Another thing is, I think this is something that implies to everybody in the United States. U.S. Healthcare system is deeply flawed, right? I think many people have conversation. We joke around on the internet and to each other about the expensive hospital bills, how you go in for one thing and then you end up by being bankrupt. I think healthcare bankruptcy is actually pretty common in the United States, and United States is, from what I know, one of the only westernized country or modern country that is dealing with so much healthcare, health, health, the, the health cost of healthcare. I think is really crazy, and how the financial cost is so much, and it's not even feasible. Yeah, is anybody who has issues who had to deal with healthcare issues before?
I can speak on this. Hi, everyone. It's Casey, pronouns she, her, hers. So funny story about my birth. I was born X amount of years ago, and at the time, my dad had been like switching companies, and so his insurance was like supposed to like roll over and like cover most of the expenses of my birth. But what ended up happening was the hospital, I think they denied it. They were like, "No, you're no longer covered." So we were almost gonna have to pay like, oof, I don't even remember how much, but I know that they had been saving up to buy a house at that time, and they would have to use all of the savings that they had. And so that was like, so whenever they tell me about the story, I'm like, well, what did you do? How did you like find a solution to that? What they ended up having to do was my dad, I think, spent like $100 to like expedite certain documents from like the insurance companies to overnight it to the hospital, and the hospital gave them like a hard deadline to like bring all the documents in order. Luckily they were able to like get over that, but I don't know where we would have been if my dad wasn't able to do that. So I know that like hospital fees are like can be so crippling, especially in the immigrant community. And I think that it's something that the politicians or like the country should really look into, because I don't think families should be struggling so much just to have like to celebrate like the birth of a child, for example. Or even like if someone were to get hurt, like getting hurt shouldn't be crippling to your financial status.
Yeah, thank you so much for mentioning that, Casey. I I think hospital bills are insane. It's way overpriced. I think so. We also have the chat. I think Ria is mentioning that getting hurt is expensive. It's expensive to live. I think in general, to be a survivor, like to live. I think it's expensive to keep living, especially in the United States, and especially in particular to California. Um, I think I had a friend of mine who got married here, and they were expecting, but what they did was they went back to Indonesia just to have their kid because it was more cheaper to fly to Indonesia, stay there for a month, and coming back than to have the kid in the United States. I could not believe like how crazy they said it was way more affordable to fly to another country, have the kid, spend there a month, to take care of the kid, to get everything, living expenses there, and then to come back, then just to have the kid in the United States. There's something wrong with our system. Yeah, I think Blue wanted to say something.
Yeah, I just wanted to sort of echo, what everybody has been saying, but I also wanted to give you like an example. So I had a friend that, he came here to the United States, and he came to the same college as me, so we went to school together, but he was Canadian. And unlike me, because he's a Canadian citizen, when he went back to Canada, he has universal healthcare. And one of the things that he told me was that his mom needed treatment for like a surgery for her back, I think. And then once all the process was done, and then she got the treatment, the only thing that she ever had to pay was parking. That's it. Everything else was covered because, again, they had universal healthcare. And I can't believe that as a developed nation in the United States, we can't have something similar to what Canada has. And he always kind of tells me how baffled he is, how, Americans, as a nation, we survive, especially for those that don't have insurance, because they also have like regular checkups that don't cost them any money, that they can go and sort of get checked up to make sure everything's okay, which I don't think it's available for people like us, or people in general. And it just makes me feel like there's this glaring difference between two countries that are supposed to be considered developing nations, and they are our neighbors, but their healthcare system is a lot different than ours. So it just makes me think about how behind the healthcare system in this country is compared to Canada and other countries as well.
Yeah, I think a lot of us, at least those who are in the United States who might be listening, we're just so flabbergasted that all they had to pay for was parking. Because for those who've been to the hospital, we say you still have to pay for parking here. It's not like we're paying all this money and parking is covered. You still have to pay for parking on top of your treatment. Yeah, it's really, I think it's very evident that U.S. healthcare system is not really for the people, but it's actually for profits. It's putting profits over people, and it's very evident over and over again that it's like that. Yeah. So there's been one case years ago when I was a long time ago when I saw this uh, news article of this old person who was senior who actually quote unquote robbed the bank, but they didn't really rob the bank. They didn't bring anything. They just brought a note saying, "I'm here to rob the bank," because they wanted to go to jail because people who are in jail actually gets health care. I was like, that's insane because I think this person had terminal cancer and they couldn't afford it. So they rather go to jail to get their health care covered. It doesn't make any sense to me how we live in this supposedly land of the free, home of the brave, and all this, country that is so prideful in being this city on a hill, and yet we can't even take care of our community members. And I think these stories are way too common. I think most cases, some people talk about how my brother, he used to get in like he was very clumsy. I don't want to throw him under the bus, but he was very he was very accident I don't know, not opposite of accident prone. And one time he was riding a bike, he got hit by a car, and the ambulance came and they took him away, to the hospital. He was okay, but he took the ambulance, and then my parents were saying like, that's insane. He was okay. We could have just picked him up because he was so expensive. I think the last thing you want to worry about in when someone is in dire need is worrying about how you're going to pay for this. You want to worry about whether or not this person, you want to be there for the family. You don't want to think about how much it's going to cost you as a family. So yeah, it's so common in the United States. So okay, we're actually gonna talk. If nobody else has anything to say, we're gonna actually talk about public charge at this moment. Okay, so for those listeners who are not familiar with public charge, so the public charge is basically in the conversation of how former immigration and naturalization services, and now the U.S. Citizenship and Immigration, or USCIS, refer to an individual who is likely to become a primary dependent on government for substances or demonstrated by either receipt of public cash assistance for other services. So under the public charge rule, immigrants to the United States are classified as likely or liable to become a public charge, may be denied visa or permission to enter the country due to their quote unquote disabilities or lack of economic resources. This is something that's been conversation for a really long time in terms of immigration spaces. Public charge is something that has come up over and over again. So this term describes people who cannot support themselves or who are dependent on a benefit that provides cash, such as supplementary security income or temporary assistance for needy families for their income. So a lot of the conversation of public charge has been, oh, immigrants are coming in and taking our resources or whatever, even though it's far from the truth, right? But recently, USCIS has stopped applying the public charge final rule to all pending applications and petitions starting on March 9, 2021, this year. So USCIS removed content related to the vacated 2019 public charge final rule from the affected USCIS forms and has posted update versions of the affected form. So from this going forward, as long as this current system is in play, people who have used public resources who are undocumented or immigrants, it will not negatively affect them when they apply for citizenship or legal residence in the United States. So it's been a huge push by the immigrant communities, even though still now a lot of immigrants still are scared of using public resources, or even though they have such a lack of resources to even get, but they're, even for those small resources, they're afraid of getting it because they were scared that it would negatively affect when they apply for citizenship. But now, starting March 9th to this year, it's no longer a factor. But hopefully we're going to keep it that way going forward. Last thing I wanted to say is a few things about campus and university healthcare. I know that we were going to talk about during the resources, but I know that me, as well as all of us here, have some sort of experience with campus resources, whether it is they used it or know about it. I know some of us mentioned it. I think Ria mentioned it as well. But yeah, I want to talk a little bit more about like utilizing some of the resources you have right now. So does anybody else want to say anything about campus university health insurance?
I can try to advocate. When I was attending school, I think all of the upperclassmen advocated for taking advantage of the mental health resources that are available. So setting up an appointment with a therapist, just to talk about how stressful school is. And although mental health has been, or talking about mental health has been on the rise, and it's pretty open. A lot of people are more open talking about stress and mental health and depression and anxiety. It's still really hard to take that first step to make that appointment with the therapist. But if you're in university and if you are in college, I highly, highly recommend at least taking one session, because it helped me a lot during a time when I thought there was nothing else to be done. And obviously you have your family and your friends, but if it's really difficult for you to explain, I think going to a professional who might be able to translate it into another way that can be more I don't know, easier to understand, because all the feelings that we get could be really complex in our brain, but someone else from a third party point of view could simplify it and make us feel a little bit better into or understanding what we're feeling. So take advantage of those mental health resources. I think it's also good to know what exactly what is covered in your health insurance for school, because it says you can get like checkups and go to a therapist and stuff, but they cover surgeries, they cover dental, at least some dental, they cover massages. Like there are things that people and students aren't taking advantage of. So read up on that insurance because it's very nice.
I will also hop onto this bandwagon because I'm also an advocate for utilizing campus resources. I think everybody here in this podcast has like graduated college or is beyond that now. I'm still in it. I'm in the system. And I can only speak for community college resources, as that's the only thing I'm familiar with at the moment. But I know that it varies from campus to campus. But I know that within like my district, as long as you paid like the $5 health fee, you were eligible to receive almost all of the services that the health and wellness center provided. So that would be like therapy sessions, checkups from the physician, talking to the school nurse at any time and getting treated for anything that like was like surface level injuries. And like Ria said, I think it's important to take advantage to even expose yourself or bringing up the courage to talk to the therapist, because even if you might not think it's a great fit for you, if you're like, oh, I'm not so sure about therapy or I'm not sure about this school therapist, they are also equipped to point you in the right direction. So even so, speaking of like the undocumented community, you could possibly go to your campus health and resource center and ask them, do you know of any clinics that will not ask for any specific identification, that will keep everything very private? What are some trusted resources that they can provide to you to better help you and your family? And yeah, that's all I have to say.
All right. Ria, did you want to say something as well?
Oh, I thought Casey brought up a very good point, especially for undocumented individuals. Um, Hopefully, if your school is open to talking about the undocumented experience, they actually have therapists who are trained to talk to people who are experiencing mental health issues because of being undocumented. Or even if there is an undocumented space, that could also be used for group therapy to talk about undocumented issues. So if there's no one at the school who can properly or you don't feel comfortable talking to, I think Casey brings up a good point in that they can point you in the right direction.
Yes, thank you so much. Yeah, so I think I could also talk a little bit about my personal experience. I actually used a lot of the of the healthcare resources. I actually used dental, vision, once with mental health, and then a regular physical checkup. So I attended UC Irvine, and we have a what's called a USHIP. I think it's similar to all the UC schools and campuses. And yeah, I got my wisdom teeth wisdom teeth taken out with USHIP dental because I've never had health insurance before this prior. Right? I was in Korea. I think they had some sort of health insurance. When it came to the United States, we didn't have any sort of health insurance, so I was really worried and concerned. So my last year, right before graduating, I used so many other resources. I was like, oh my gosh, I gotta get everything done. So I got my wisdom teeth taken out, both of them taken out. The on my left side. So the right side I had to take it out later on, but it was dormant. So I got my left side taken out. I think every quarter you also can get like teeth whitened. So I also did that. For vision, I got my glasses taken care of. There was right next to the campus. There was this like a eyes, I think glasses store, and they also do checkup, and they took U-ship, and because a lot of the students went there. I also did regular physical checkup, because I wanted to make sure if I was sick, I find out I will find out as a student so that I can get everything done. So I didn't really have any huge health complications, but I know that I really utilized, multiple times, because I was scared that if there was something were to go wrong, at least I can find out right then and there rather than having to find out after I graduate. These are some of the things that, I think it's really, really, really scary. I think what I was worried about, especially with a lot of other people who are not just undocumented, not just immigrants, but people who just couldn't afford healthcare, they have to really utilize what they have and when they have it. So yeah, I think it's pretty. Yeah, definitely. I think a lot of us really do use as much as they can, and hopefully, if you're a student right now at this moment, please be sure to find out health insurance information that you might have access to in your campus. And if you're not a student at the moment, yeah, there's a lot of other resources that are public information that we can help you out as well. But yeah. So I think that's pretty much it. Does anybody else have anything to add before we end our today's podcast?
Yeah, I just wanted to quickly just say, don't be like me and not use the resources, because I do regret that a lot. So for anyone that's listening, that's undocumented, that is going to school right now in university, you should, be more brave and, search those resources, because, now that I know that, there was all these resources available, I would have been more open, because the only time I actually reached out for healthcare resource of some kind was when I needed a vaccine, because I was actually dorming and I needed a vaccine for me to be in that dorm. But that was it. That was the only ever healthcare resource, I guess, that I kind of used. But yeah, the whole point is that you should, if you're undocumented, and you think that there's no resources at your university, the most likely scenario is that there is a lot of resources. So yeah, just reach out to somebody that can help you, and take advantage of the resources.
All right. Thank you so much, everybody. Yeah, be sure to really use it. Be sure to let other people know as well. I think you technically, as a student, you're paying tuition and you're paying those fees. You're already paying for it. Might as well use it because you're already paying for it. So, okay. With that, I think we're going to end it today. Thank you all so much for listening on our conversation and our SUPP podcast episode 3 regarding healthcare resources for immigrants and undocumented folks. Hope you all have a great rest of your day. And as always, please be sure to stay safe and healthy during this time. Yeah, and please be sure to join us next week when we talk about fitness and diet by Blue, who's actually going to lead us into discussion about what Blue has been doing in terms of fitness and diet. All right. Thank you all so much. Hope to see you all next week. Bye.
Bye bye.
Yeah.
Bye.